This segment is sponsored by Golden Triangle Internal Medicine.
Hello, thank you for joining for another edition of Ask the Doc. This is Dr. Levine of Golden Triangle Internal Medicine and Geriatrics. Our first question of the day. I was served an ad on Facebook that said you can send in a blood sample to see what foods you are sensitive to. Is this a hoax, a marketing ploy, or are there really foods that our bodies can be sensitive to that can cause health risk? I think the biggest one that is out there is gluten. And just to remind you, gluten is a protein that's found in wheat. And just to remind you, wheat is used in a lot of products. Our country eats a lot of starch, bread, pasta, rice, flour, and they use wheat primarily in those products. So gluten is one of those things that's been around for a long time. And we recognize that people are sensitive to it. And what I mean by that is when you eat gluten, again, in wheat and starchy products, you might feel achy or fatigued or have abdominal pain, diarrhea, or crampy afterwards. It can get pretty severe, the sensitivity, which we call celiac disease, and you can develop other more serious medical problems. Severe neurological problems where you can't talk, stroke-like symptoms, and certainly gastrointestinal cancer because of all the inflammation that it generates because your body is sensitive to it or allergic to it. So most people have a sensitivity to it where just by avoiding most gluten products, you should be okay. But certainly people who have the celiac disease, that's a much more serious disease and they have to be more strict with their diet. So there are some sensitivity issues out there with food. I think the testing maybe is premature and would not be very clear about what to eat or not, so probably not something I would advise. But certainly if you're having medical problems, work with your primary care physician or gastroenterologist to get a little bit more clarity on that. But there are some issues out there with food sensitivity.